We were cautiously optimistic that this was a disease that would be confined somewhere else. However, as the pandemic progressed, we saw quite realistically that we needed to jump in.
In general, for hospitals across the country, there are no competing hospitals at this point in time. We are all in this together, and everybody's willing to step up.
You cannot go it alone.
We feel that it's our role as a community provider to reach out and cross bridges and lend our expertise. Focus on your leadership team. Burnout is a real issue.
If all my surgeons go out or all my ER docs go out, how do we work on this together?
We certainly have that attitude here. We take care of each other.
I really worry about what the staff's going through. They're going to work courageously every day, knowing there's a possibility they could become infected themselves or they could bring it back to their families.
It can happen to you. You got to be prepared. It's what hospital operators do.
Rural hospitals always seem to be at the end of the supply chain for personal protective equipment, for testing equipment, for supplies. We had to develop new sources or substitutes.
And there's also financial challenges, and we're dealing with that as a hospital as we're seeing our revenue drop. How do we make sure that our team doesn't suffer financially on top of the heroic work they're doing?
Don't think that you're going to have to answer all these questions by yourself. Call your colleagues and talk to them like we do in rural health. If we depend on our colleagues and talk with them, ask them how they've handled it, or if they know somebody that has, they can be a tremendous resource for us.